A quick disclaimer before we begin. The PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast. Today's episode might be a controversial one, but it's a conversation that needs to be had. We're diving into all things intensity with one of our favourite past guests, Bryant Meyers. Firstly, welcome back, Bryant. And if anyone missed the first episode, can you just quickly introduce yourself and anyone who missed the first part?
Yeah, I'm Bryant Meyers. I'm author of a best-selling book on PEMF called The Fifth Element of Health. I've been doing PEMF therapy for 18 years. It's been my passion, helped thousands of people. I've been in energy medicine for 30 years, but I've seen that PEMF just works better and faster than a lot of other forms of energy medicine, even though I like other forms like red light and others. But for me, if there's one thing I wouldn't do without, it'd be PEMF, because it's just my go-to for any injury, any health problem, anything that goes on in my body where it's out of balance, or performance. I play pickleball, so I use it for performance to perform better too. So it's my passion, because I've seen it change lives, save lives. And I used to teach physics at the college level way back in the day. So I kind of use all that knowledge of physics to kind of give a scientific solid foundation to PEMF. And I find a lot of people in the industry don't seem to understand some of the basic scientific principles behind PEMFs, which leads to a lot of errors in their recommendations, which we're going to get into some of that today. So anyway, just a little bit about me. I definitely, this is my full-time passion right now. So
no, and we can see that because, doing some research for this episode, we looked at your buyer's guide, and our podcast producer, Josh, downloaded it for me to read, and it was 200 pages. So
yeah,
there's definitely some extensive research has gone into this part.
Yeah.
But, as an advocate, we talk about PEMF obviously on this podcast quite a lot, and there's ways of breaking it down. And one of the main ways is through intensity. So you see a lot of low intensity versus high intensity going on in the market. I think there seems to be this notion of them and us, a lot of it, because it's quite rare that you get one manufacturer that does both.
Yeah.
And therefore, when you get a low intensity manufacturer, they're obviously going to say that it's better than high intensity. If high intensity, you're obviously going to say it's better than low intensity. So there is a lot of kind of myths and misconceptions going on out in the market. And we want to have this discussion today to really get nitpicky into, more on the high intensity side of things, because high intensity is a lot more expensive, which we'll get onto. And there seems to be this notion that it's the one size fits all. And we want to just kind of make an understanding for that it's not the one size fits all. We don't want people to be spending more than they need to.
Yes.
And they can get, healing powers from other products. So before we get into the myths and science about the intensities, and that's why that's such kind of a misunderstood topic, we talked a lot about slew rate last time being like the most important thing to look out for. But how important do you think is intensity?
Yeah, intensity now, slew rate, I think, is the most important parameter in PEMF, in my opinion now, based on my current understanding. Because even the frequency resonance side of PEMF, when you have a higher slew rate, you get more frequencies by a Fourier transform. It's just the nature of the steeper slope gives you more frequencies in the spectrum, right? So I do feel slew rate's the most important parameter, but unfortunately, most PEMF studies do not list slew rate. In fact, I have about 19 or 20 good slew rate studies, and I'm hard pressed through extensive searches on PubMed to find PEMF studies that list the slew rate. Sometimes you can figure it out, like with the I1 and that inflammation study. I was able to see their website. They published their rise time, their peak intensity. You can kind of calculate, but their studies don't list slew rate. They all go by intensity. So intensity is important because it seems that the medium intensity, if you just play the odds, you're probably going to get a pretty good slew rate, assuming it's not just a slow sine wave like the Chinese crystal mass, right? Because they can get up to a medium intensity, right? They got such a slow rise that their slew rates are dismally low. So
yeah, and that's a good point, because we did our own testing when we were testing the Celerate map to look at our slew rate. And coming on to your point, it's actually very difficult to measure slew rate.
Yes.
And that's probably why a lot of people don't publish their slew rates.
Yeah.
But yeah,
My little Hall effect probe thing here. It's a cheap $12. It's not even a very expensive one, but it is not easy to measure slew rate. Because you got to have a nice oscilloscope and the Hall effect probe, and and you got to know how to convert like 65 millivolts to 1 millitesla or whatever. But the point is most people in the industry don't know how to measure slew rate, or they don't even. I mean, I hate to say it's probably true. They probably don't even know what slew rate is unless they've seen Robert Dennis or some of my recent stuff. But medium intensity is almost always listed in PEMF studies. So, and we'll get into that meta-analysis, of over 3,200 studies. But so it's just kind of my hypothesis that if a study doesn't have the slew rate listed, if it's a medium intensity, it's probably going to have a decent slew rate, but maybe not. I mean, if it's again but if it says it's a sine wave and a low frequency sine wave, then you can probably know that it may not, right? So if the wave shape is listed, let's say it's a square wave. Well, if they list it as a square wave shape and a medium intensity, you can almost be guaranteed it's going to be a good slew rate, or at least a decent slew rate. So that's why intensity is important. And intensity is also of secondary importance in slew rate scientifically, because it's dB/dt, right? It's the change. It's how slew rate is how fast a PEMF signal reaches its peak intensity, and how fast is the rise time, or So you do need a certain amount of intensity if you want to, otherwise because it's hard to get a really fast rise time, right? So a medium intensity allows you to have, again, makes it easier to get a therapeutically, clinically backed slew rate, which I have 19 studies that I took the average of mean, median, and mode, and around 30 Tesla a second is kind of the average of those. But remember, some of those are smaller devices too. So, I mean, it's easier to get a higher slew rate in a smaller device. But yeah, I would say that's why intensity is of secondary importance, because it's kind of in slew rate. And most PEMF studies don't list slew rates. So we have to, the intensity can give us a hint, that it might be a good signal that has a good slew rate.
So yeah, I mean, intensity, we see intensity as such an important factor because, like you mentioned, it's really one of the only defining features online when people are trying to buy a device. So you can't really compare slew rate very easily, but most companies will list their Gauss rating or their intensity rating. So, and if you go onto websites like Dr. Pawluk's website, he literally says, this intensity will fix this, so there's no mention of slew rate, there's no mention of coils or anything like that. His results are based solely on what the intensity is offered by that product. So obviously people were using that to categorize what system. And, we have always been looking at different websites and how they differentiate and direct people when they're buying product. And, one of them is specifically saying you need the most intensity to get the most results. And to get the deepest penetration. And so all these different things we'll come on to. But all these people that are saying high intensity online, and some of them are saying that is dictating your result and that's the only way to go. Do you agree with that?
Of course, absolutely not. I mean, because I give the exaggerated example that you could have a big 6-foot full body mat and a little tiny coil just in the middle, and you could have 1,000 Gauss, but it's just a little tiny spot, and it's not going to penetrate very far because it's a small coil, right? And it turns out it's easier to get a high intensity in a smaller coil. I mean, it's just the nature of current. I mean, if you take a certain amount of current and you put it into a bigger coil, you're going to get less intensity than if you have the same amount of current in a smaller coil. It's like focusing a flashlight, right? If you have a flashlight spread out and you focus it on a spot, it's the same amount of light total, but you got all of it on one spot. So it seems like, but so, I mean, it's just harder to get a higher slew rate and more intensity in larger coils. So that's one problem with intensities. It doesn't tell you how much area you're covering in the body and how deep it's going. And again, the other problem with intensity only is it doesn't tell you what really the slew rate is or the signal shape. So, you could use, like we've seen with the Chinese mats, you could have a decent intensity. They can get 10, 20 Gauss or whatever they can get up to, 30. But because they only have the rise time is only 8.3 milliseconds, their slew rates are like 1 Tesla a second or less. So having a slow rising signal is not a very therapeutic way to do PMF, even if you get a decent intensity. And even if you get high intensity, I really want to test some of these higher intensity because they're putting a lot of like a poor signal through a lot of inductance or a lot of windings and big coils. And my guess is some of those may not even have a great slew rate. They probably will though, because there's just so much horsepower that that's the thing with high intensity is almost by default, you're going to get a relatively high slew rate, but then it gets to be too high. And usually is the case. And studies show, like the PhysioSim study showed, that when you go to beyond 30 Tesla a second for bone healing, we're just talking about bones now, at 100 Tesla a second, it didn't work as well as 30. And 30 worked better than 10, right? So, and then 300 didn't even work as good as 10 Tesla a second. So you can see more is not better. And with the PhysioStim study, they had the same rise time on their signal, right? So they were just turning up the intensity. And they were in that night. And in my buyer's guide, I list like 7 or 8 studies to show that not just this one, but there's more studies to show that when you go higher, the healing goes down at a certain point. And there's no consensus where this biphasic dose like rests because there's so many variables. But it does seem to me slew rate is the most biologically active aspect of PMF in my opinion, because that's what's actually inducing microcurrents in your body through Faraday induction. The intensity doesn't. You could to me, intensity is for measuring static magnets, right? Because you can, if you have a galvanometer, you can get a current going through a wire with just moving a magnet through Faraday induction, right? You could have a 20,000 Gauss neodymium magnet in the middle of that coil and just sitting there doing nothing, and you get no current. So it doesn't matter how much intensity you have. If you're not moving it, you're not going to create any induction. Now, because the body has moving charges through the blood and lymph, you get a relativistic effect from even static magnets, right? But in general, the intensity, I tell people it's like saying that volume is or loudness is the most important aspect of music. Saying intensity is the most important aspect of PMF. Because yes, you need a certain amount of loudness to enjoy the music. If it's too quiet or too loud, that's kind of a good metaphor because with PMF, I think you can go too low, especially for regenerative benefits. For resonance and relaxation, yes, low intensity can be nice. But for really healing the body, you need a certain amount of volume, to get the slew rates that are therapeutic, but too much, you hurt your eardrums if you go to a rock concert and you're next to a speaker or something. It's just too much. But again, we'll talk about high intensities and its places. It does have a place in a clinic, but it's just, to me, it's a more narrow range. So
and I think it's a good notion to kind of break it down. I'm a good advocate for low intensity and high intensity, and I think you are too. But it doesn't mean, if I have a Ford car and a Lamborghini, one is a hell of a lot more expensive than the other. But they're both going to get to the same destination. And I think that's what we're trying to kind of demystify a lot of the time. And it's how you get there. And, if you put your foot down in the Lamborghini, the wheels might spin. You might actually apply too much power. So this is this is an easy way to break it down and explain the difference between the high and the low intensity is that, the destination's there. We're going to get there. It's kind of how we get there. Doing some digging before this episode, we looked at your buyer's guide and there was a bit about repetitive transcranial magnetic stimulation, so rTMS, versus high intensity studies. And there's a lot of confusion in that, which kind of inflate the numbers. Can you break that down for our audience and just explain what that's about?
So like a lot of people, a lot of the PMF's high intensity studies that are quoted by, and we'll talk about Dr. Pawluk more, but he's, his books are just the top selling books. I have them right here. They're actually, they're decent books. The first book is, I think, the better of his two books, because now it does some of the stuff on intensities not right, some of his recommendations, but just the history of PMF. But he quotes in this book 508 PMF studies, and I actually went through all of them. And I will get into this. I created the table. It took me 3 weeks to do this. And I not only went through this book, but I went through all of his ebooks. He's got like a lot of these ebooks online. I got like 12 of them. And I went through his other supercharged book, and then he has many contributing chapters and many books on electromedicine, right? And so all the citations that he quoted on high intensity, over 2/3 of them are rTMS, repetitive transcranial magnetic stimulation. And I don't think it's fair to cite those studies for when people are looking for a home device, and you cite an rTMS study to justify high intensity, because you've seen like the NeuroStar. It's almost like a figure 8 loop for the brain, and you have to be trained. I mean, this is for clinics only, right? And you're focusing the PMF energy on a specific lobe in the brain for a specific purpose. And it's kind of, I mean, it is kind of like electroconvulsive therapy, which used to be called electroshock therapy. And they still do that, by the way, but they put people under, and then it's, to me, that's not, I mean, but I guess in psychiatry, when you have certain extreme cases of, psychiatric disorders, sometimes there's a necessary place for it. So rTMS is certainly you could say a softer, or it's not as intense or as invasive as electroconvulsive therapy, right? But when you look at all the rTMS studies, they are mostly all on the brain, right? So when you reference those studies as a justification for high intensity, you're really, I mean, yes, it does have its place for brain health. For the studies on rTMS center around PTSD, depression, especially major depression disorder, anxiety, addictions, food addictions, smoking, drug addictions, even certain brain, they use it on certain brain disorders, even like Parkinson's and MS and TBI. Although interestingly, Dr. Pawluk, one of his only studies he did on TBI was with Robert Dennis, and it was using a 10 millitesla intensity. So it's kind of ironic that his own study is middle intensity, but the rTMS does, again, it's got a lot of research. It's got FDA approval even, right? But it's just a narrow range of applicability for these psychiatric disorders and a few brain-related physical issues. But interestingly, the MS, Parkinson's, a lot of those middle and lower intensity have actually a lot more studies for those. Where the rTMS will have more studies for seizures, PTSD, and a couple. But even like depression, I found more studies with low and medium intensity than high intensity, even rTMS.
Yeah. So yeah, I mean, the confusion's coming in the market is that these higher intensity devices that are designed to be used at home with a mat and smaller applicator are citing these rTMS studies, which effectively you could never apply the same application, same, so it's kind of saying we have all these benefits, but actually you can't do that with our device. So it's just causing a bit of confusion. We're talking about studies, and you mentioned studies. There was 3,200 studies that you've looked at.
Yeah.
And you referenced that only 2 to 3% of these studies are actually using high intensity devices. So there's a very small amount of studies out there at the moment that are using high intensity devices. So again, it's not to say that there's no benefits or no effects or anything, but the studies around high intensity is a lot less at the moment. But
there's a lot less, yeah.
What is the most and least researched intensity ranges that you've found? So going from low to high.
So just to be clear, I didn't read every one of those studies. This was what's called a meta-analysis, which is it's just a study of studies, right? Where you're basically taking studies and you're putting it into a submitted research paper where you're summarizing all the studies statistically and trying to come to conclusions about all that study. So it's actually some of the best research is these meta-analysis type of studies. And this meta-analysis with PMF looked at over 3,200 studies on PMF. And what they found was 75%. Now, it says 60% in the table, but you got to understand 20% did not list the intensity. So only 80, because 80% listed the intensity, 60% of 80% is 3/4. So 3/4 or 75% of the studies that reported intensity were medium intensity between 1 and 10 millitesla, or 10 to 100 Gauss. That's a huge lion's share of PEMF studies. Okay, about 20% were low intensity or so, something like that. And then you had this sort of medium-high range that hardly any, maybe only a couple percent. And then the high intensity had 2 to 3%. So so anything over let's see, 10 millitesla, which is 100 Gauss, was less than 5% of these studies. So
and go on.
Yeah, and then we'll talk about this too. And then on top of that, the medium intensity by far had the best cellular response, meaning that it's almost like the cells could hear the medium intensity better than low and high, because of all things that you got things like protein protein expression and gene expression, cell viability, meaning the cells are stronger, cell motility, cell differentiation for creating new tissue, cell proliferation, where cells divide to create new tissue and to heal, because our cells are dying every day in our body, so we have to keep making new cells, right? And then transduction pathways, like the A2A receptor for its inflammation. So all these at the cell level, the medium intensity were creating the most dynamic effects.
Yeah, it
was like 50% versus 38% and 36% with high and low. So low is a little better than high, but medium was way better than both.
Yeah. And it's an interesting conclusion you come to, because, when I was designing Celerate, started the design 8 years ago, it took us 6 years to get it to market. It's the intensity range I ultimately settled for was 1 to 100 Gauss, because the research I'd done at the time was finding that, these were all the clinical papers that had been done on it. These were the ones that the results and everything. But it's hard to get that across to everybody. People, because of this intensity myth, it's very often that people come to us and say, well, when you designed it, if you had complete free reign to design it, why did you only go up to 100 Gauss? And it's like, no, it's not only. There's a reason why we went within that range, because it's most effective to the cells.
Exactly.
But something I hear quite a lot in the market, and actually, I'm quite guilty of saying this as well, which we'll come to, where I got my training, which was actually kind of through Dr. Pawluk. But it's this notion of the higher intensity, the deeper the penetration.
Right.
And it's quite a common thing that is mentioned, and even some of the podcasts, the very beginning ones, we talk about intensity and the bigger field range and things. But actually, when testing the Celerate, the mat only goes up to 50 Gauss. I said only. Mat intentionally goes up to 50 Gauss, but we were measuring the field range at least 2 meters from the surface of the mat.
Yeah.
So it kind of doesn't match up with this higher penetration, higher intensity. So can you explain why that's not so much the case, in terms of you need higher penetration to get to certain organs of the body,
There's actually several layers to the confusion. It's not just one. The first layer is just straightforward. Sometimes I've heard high intensity people say that the tissues will block, certain amounts of energy, but it turns out that the body is transparent to magnetic fields. So that's called the magnetic permeability constant, is what it's called. Physics is almost, it's within like 0.5% of free space, meaning magnetic fields go through you as much as they just go through space. See, that's not the case with electric fields. Electric fields, your dielectric of your body is about 50, because water is about 50 and you're mostly water. Meaning electric fields get blocked from going all the way in, or they will go in, but they get blocked very quickly. And the higher the and it's also frequency sensitive, so higher frequencies get blocked and different. So with magnetic fields, it's totally different. And light's the same way too. If you do red light therapy, you got to deal with reflection, you got to deal with scattering, you got to deal with absorption. And the light only goes about, I don't know if you know this, but in red light therapy, you're only getting about 5 centimeters penetration. And that's from the cadaver studies. So there's been some good research on red light to show that the light is not going much more than 5 centimeters in. PMF, I can lay somebody on a PMF mat, measure above their belly button the intensity, take them off the mat, measure it again, and it's about the same. Now, this doesn't mean that none of the energy is getting absorbed. It's just that, and it's really interesting. I think Robert Dennis kind of talked about this, so I'm not going to take credit for it. But if we have an injured area, like the cells rupture, all the electrolytes will leak out, and that becomes more conductive. So PMF is almost like honing in on those injured areas. So the energy gets absorbed primarily in those damaged, injured areas. And then what's not used just passes through. So if you've got a really accurate measurement, you're going to find maybe it does get a little bit of absorption, but it's such a small amount. But for the most part, and you can do this test yourself, get somebody on the mat, measure the intensity, and then have them get off the mat and measure it again. And that kind of proves that the body's very transparent to magnetic fields. Because you can't do that with red light. You don't see red light coming through your belly button unless you're like really, really thin. I mean, you can see it through your hand, because again, your hand's less than 5 centimeters. So I can shine a light on my hand and get light to come through. So if you could shine PMF, but we can't see PMF, but it would come through you just shine right through your whole body. You know? So, and then that's one layer. The other layer is the idea that magnetic fields drop off with an inverse square law. And this mainly comes from Dr. Pawluk in his tables. And unfortunately, he's got this in all his books, all his articles. He talks about it on his podcast over and over again. And it's really the basis of his recommendations. And we'll get a little bit into it if you want to. It's really the Massari study in inflammation plus the inverse square law equals Dr. Pawluk's intensity recommendation, depending on what tissue you're trying to target. And it's alpha. But the problem with that is it's not the inverse square law. It's the Biot-Savart law. And I spent a lot of time going through this stuff because initially I was like, where in the world did he get this table from? It turns out, you see here this is a 1/2 inch diameter sphere. His tables are coming from a 1/2 inch diameter sphere. And if you work out the inverse square law, 1 over r squared, you'll find that what I'm saying is true. And I know it sounds ridiculous, and it is ridiculous. But I don't see, Dr. Pawluk just had no idea that the inverse square law only applies to point sources. And at zero distance away from a point source, you get a singularity, so you'd have an infinite intensity. So of course you can't do that. So you got to use a sphere. So if you look at his tables at a 1/2 inch away, he says that you're now at 25%. Okay, that comes from 1 over r. So the r here is 1/4 inch. If you take another 1/4 inch, now that's a 1/2 inch, and then you find that that's 25% from a 1/4 inch sphere. An easier way to look at it is the Earth. The Earth is, I'll put it in kilometers since you're in the UK. The Earth, the radius of the Earth is 6,300 kilometers. Now it is a 1 over r squared law for gravity, but the gravity drops off to 1/4 or 1 over r squared at an extra radius distance from the Earth. So you have to go up 6,300 kilometers, and then you find that the Earth's gravity drops off to 1/4 based on the inverse square law. So when you can apply the inverse square law to spheres, right? But then you would need a different table for every size sphere. But of course, PMF coils aren't spheres. But I promise you this is true. You can just take it, as a hypothesis now. But if you work out the numbers on Dr. Pawluk's charts, and I challenge anybody out there watching this can prove this to themselves, all of his charts are coming as if a PMF magnetic source is a 1/4 inch radius sphere. It's just what it is. Now, why he chose this, you got to ask him. I don't know if he was smoking something that day, but it's ludicrous. And again, when you use the Biot-Savart law, you also have to have a different size. Like I have here a tenon. Loops are easy to measure with the Biot-Savart law because when you got a coil, it's more complicated calculation. So I was able to look at, the Biot-Savart law with just to prove Dr. Pawluk wrong once and for all. This is 10.5 inches. This is 1.6 inches. I did many calculations, and you can see the calculations on my BryantMyers.com, my full reviews, and the 200-page buyer's guide you read. I've got all the calculations, and I did both the calculations and the measurements with the Hall effect probe, and they matched very closely. And so Dr. Pawluk claims that I'll just say 4 inches away, because it's 15. This loop is it's 29 Gauss in the middle. And then 4 inches away, it's still 15 Gauss. That's Dr. Pawluk's magic number, 15 Gauss, right? And we'll talk a little bit about that. So he said at that distance, it's something like 0.06%. But the bottom line was his table was 7,600% wrong, meaning the intensity was 76 times higher than his tables predicted. Because again, his tables are based on this. Look at this. You see the problem here? If you use this as a table to predict all PEMF devices that have all kinds of different coils, you see how absurd that is? And I know this sounds like, Bryant, what's Bryant talking about? No, if you work out his tables, you will see they're all based on a 1/4-inch radius sphere. And no PEMF coil. Now, it turns out, interestingly, that for really, really small coils, like this coil, this is Robert Dennis Isis coil, at 3, 4, and 5 inches away, Dr. Pawluk's tables worked okay for this coil at 3, 4, or 5 inches away. For larger coils like your coil or any large PEMF coil, it's wildly inaccurate. It's not even close. And on a recent podcast with Ben Phillipson actually took him through the BIOS of art law. And he's sitting there explaining it to him. At the end of it all, Dr. Pawluk is like, well, the inverse square law is still a good approximation, right? Like he just he wasn't listening at all. So he's been pointed out his errors. So that's why I think we're at a point where, we can be nice for a while, but 10 years have gone by and he's getting people buying these $12,600 devices based on the inverse square law. And that's really his only justification.
Yeah.
Along with the Masari study, the 15 Gauss Masari study, right? That's it.
Yeah,
look at all his stuff. He's got no other foundation to recommend high intensity except his, again, cherry-pick citations.
Yeah, and I think the frustration comes from, you offer consultations yourself. We offer consultations through the Business NewMed where we hold other PEMF devices. And, we're often kind of undoing a lot of the conversations that they've had with Dr. Pawluk through their consultations because, we'll have little old lady down the road who's trying to use PEMF for something. And, she's been told that she needs 4,000 Gauss just to reach the kidneys.
Yep.
And, it's kind of, that's where we're saying that this is completely inaccurate.
It's actually 1820. He says you need 1820 Gauss to reach the kidneys. And that's actually his favorite example is the kidneys because he quotes a study, this Kathumi study that shows that the kidneys are 4 inches to get all the way through. He cites that. And then he says, okay, because the Masari study, just so people know what we're talking about, is a really good study on on inflammation, how PEMF shuts off inflammation. And I have a quote here I want to read because it really debunks this whole position. Because this particular device they used was 1.5 millitesla, roughly, or 15 Gauss. But and Dr. Pawluk actually quotes this, because after 30 minutes of exposure, so there is a good, you could say, case for doing 30 minutes, because you get the maximum saturation of the A2A receptors. The A2A receptors are kind of like inflammation switches. You can shut off inflammation. This is just an easy way of saying it without getting too complicated. It's just you can shut off inflammation with triggering the A2A receptor. And it turns out that a lot of pharmaceuticals target this receptor, but PEMF acts as what's called an agonist, which just means it stimulates. It's opposite of an antagonist, right? So it's stimulating the A2A receptor to shut off inflammation. So this study shows makes a powerful case that PEMF shuts off inflammation. I mean, as good as some pharmaceuticals even, without all the side effects. And what they found was a saturation at 1.5 millitesla, or 15 Gauss. So again, here's another decent case for using medium intensity. But what they found was that at 15 Gauss, it just plateaus. And even, this is from Dr. Pawluk's book. This is not even from the study. Dr. Pawluk in his book says, after 30 minutes of exposure, the receptors became saturated with a 1.5 millitesla magnetic field. the effect plateaued with intensities greater than 1.5 millitesla. This means, this is from Dr. Pawluk's book now, his own words. This means that intensities above 1.5 millitesla produce no additional benefit. Just take that in for a minute.
Yeah.
This is the study he is quoting in all of his podcasts. And you see that plateau, he's just bringing it up all the time because it's the basis of his recommendations. Like you say, an old lady that's told to get a 4,000 Gauss machine, he's quoting this study and his inverse square law to deliver 15 Gauss based on the inverse, which is not the inverse square law, of course, but he's using his table to try to get 15 Gauss at varying distances into the body depending on the condition. Like for the brain, he'll tell you need a really high intensity because you got to get all the way through the brain.
Yeah.
But it's not the inverse square law. And this study itself didn't use more than 1.5 millitesla. This is the irony of it. The very study quotes it was for the knees for articular cartilage regeneration, right? The articular cartilage is the cartilage on like the bone of the knee. So they found in this study that they could not only turn off inflammation, but regenerate cartilage over 5 hours a day for 90 days. Again, putting it in perspective, you need to stick with your PMF treatments over time. True regeneration can take time. But the study itself, putting their device on the knee, they weren't following Dr. Pawluk's table. They were just using 15 Gauss at the surface.
Yeah.
It's like he's twisting that study in a way that the study didn't even do. It's just, this is why he needs to be exposed now, because it's beyond ludicrous what he's saying. And people aren't doing like what you and I, or people that are really critical, digging deep into, okay, what is he really saying here? Let's really read that study that he's referencing. Let's really look at his inverse square law tables and even see if they're even accurate, because he's not a physicist, right?
Yeah.
It's beyond bad. I mean, and like I showed you with this loop, you can get 15 Gauss with a 30 Gauss. I mean, you can get 15 Gauss 4 inches away even, which will get the kidneys, but she says it's 4 inches in, with you only need, here in this case, 30 Gauss for a 10-inch coil.
And that's the frustration a lot of the time, because as we've mentioned on this podcast a lot of times before, the intensity of a device really does dictate the cost. And a lot of that is down to the technology that has to go into creating these high intensities. You know, it needs a much bigger driver, much more copper, much more coil. So it does drive the cost up. And that's a genuine, that's a genuine flaw for higher intensity devices. But the problem is, a lot of the time, people are having these consultations and they're being told that they have to have these thousands of Gauss device machines, which go into the tens of thousands of dollars, and they really don't need them. It's really overkill for someone who is going to get, in my opinion, your opinion, the same results, if not better results, with something that is a lot cheaper and more, I'd say cheaper, and more cost effective for them, and more effective in the more medium intensity range. I'm a user of both, and we're at the moment developing a higher intensity device for Celerate. So we know that there is a market and there is a need for higher intensity devices, but it's in the right setting. It's not given to people as the only option, which is happening a lot of the time, and we're trying to kind of demystify this. You mentioned inflammation, which was important as well, because inflammation is something that PEMF devices have shown to be so effective for, like you said. And inflammation is, one of the key drivers of so many things, pain, all sorts of conditions. But interestingly, when I was reading through some of your documents, you're saying that there isn't actually any studies related to high intensity and inflammation yet.
Well, so Dr. Pawluk citations. I mean, so remember, I haven't had a chance to go through every PMF study, but I've gone through 750 of Dr.
Yeah.
But see, you'd think Dr. Pawluk would try to find every high intensity study that he could to back up. I don't know. I don't know his motivations, but from all of his studies, there wasn't any. In fact, the high intensity only had 17 conditions in total. And with medium intensity, again, based on Dr. Pawluk's own citations, I found over 50 conditions that medium intensity addressed, including inflammation and a lot of regenerative things that you didn't see much regenerative studies from high intensity. Was more analgesia. The top, that was the number one. Number two was muscle stimulation for especially urinary incontinence. Because again, like remember those abdominal belts that make your muscles twitch to build your ab muscles? So PMF, a high intensity PMF is a muscle stimulator. But to me, you're almost getting to the point of, it's almost like a type of shock therapy at that point, when you're getting such high intensity to make your muscles twitch, to strengthen your muscles. Yes, that's beneficial for urinary incontinence, right? Because it's an involuntary muscle and you can't really work that out with any exercise. You have to, again, maybe you could do some things, but typically having that helps with urinary incontinence. Drug delivery is another thing with high intensity studies, but that's the electroporation effects of high intensity. High intensity makes the cells more porous. Now, medium intensity will as well, just not as exaggerated. But the double-edged sword of doing that, when you make the cells that porous, remember the cells are very protective. They want to guard against viruses and toxins and they got these very intelligent channels that allow just certain things to come in, nutrients, oxygen, whatever. So when you open up the cells like that, yes, you can deliver maybe chemotherapy drugs a little better, medications better, but then you're also opening it up to other things that you don't want to go in the cells. That's again a very specialized application of PMF. Because it's not making drug delivery because of its improving its digestive whatever. It's just making the cells more porous because of electroporation. And then we talked about all the brain studies with high intensity, with psychiatry and some other. And then there's really beyond that. I found maybe one bone study, which wasn't a very good study because it was 3 minutes a day with high intensity for the bones. And the studies on medium intensity for bones were way better. And there were over 17 of them just from Dr. Pawluk's own citation. And well, like let's see, MS, Parkinson's, they did have a few of those, but medium intensity had all of those as well. Yeah. That was really it. There were no other studies to back up high intensity. So research supports it for only a small range. Certainly the penetration argument, which we just debunked, that's just, there's no justification for that. In fact, I found an old video of Dr. Pawluk with the QRS and Metathera. You can watch it in my older video. He debunks himself. He shows that he's even bragging with the QRS. Look, you get plenty of field way up here at 2 feet, right?
Yeah, we saw that video. It was interesting.
Yeah. So it's like, it's just, I don't know if he's even believing his own advice anymore. I don't know if there's some cognitive dissonance going on in his brain, but because he's seen that low intensity can penetrate firsthand, so I don't know what but and
it's at the point in which you start questioning the motivations, because if you've got a customer on the phone, you've got the ability to sell a system to them. Do you sell a $2,000 system to them, or do you sell a $15,000 system to them? Which one's going to make you the most money? It's, this is where the grey lines are starting to appear and the cracks, and, whether this is the motivation or, and it's up to us to kind of differentiate between all the benefits, because, like I say, it's good that we talked about some specific benefits of high intensity, because I don't want people listening to this episode thinking that all we're doing here is trying to sway people away from high intensity, but we're just trying to debunk some of the claims that are out on the market. And another one of those, like I mentioned, the Ford and the Ferrari or the Lamborghini earlier, one's a lot more expensive. A lot of people will say that high intensity heals faster, so it will get you to your destination quicker.
Yes.
Is that something you agree with?
Absolutely not. And again, I'm going by research, not just anecdotes, because yes, high intensity, especially like the unit I have, the Pulse XL, was a $40,000 device. And that seems to be here in America, the number one unit used in clinics, right? For whatever reason, it seems to be the most popular one for clinics. And there are a lot of anecdotes, right? You could say testimonials, anecdotal testimonials, but then I can tell people, when I did work with a low intensity company, I collected over 500 testimonials. So I could show them, okay, you have all these testimonials, but I can show you a bunch of testimonials. In fact, I felt the ones with the low intensity were a lot more powerful when you took the whole body of work of low intensity and testimonials, because I've only been working with medium intensity for about a year now. So besides anecdotes, it's the research, it doesn't support it healing faster. In fact, the medium intensity, when you look at actual tissue regeneration, not like I mentioned just briefly, all those high intensity studies that I mentioned that even Dr. Pawluk himself cites, except for the bone one, but the bone one was not a great study. There were really no regenerative studies. So if anything, I don't think high intensity is really all that great for regeneration and actual healing. But if you have a clinic, when people are in chronic pain, it is good for analgesia because, again, in all those studies Dr. Pawluk quoted, the number one study was for analgesia, pain relief. So there are a lot of PMF studies for analgesia that are high intensity. And there's certainly a place for a non-invasive, non-pharmaceutical approach to pain relief, right? But again, I've put it to the Pepsi challenge using high intensity and even a medium. And sometimes the high intensity does work a little better for pain, but then sometimes, I don't know how to explain it, my medium intensity device works better than the high intensity for even pain. But from research, I know, and I can talk about, again, medium intensity, there's tissue regeneration studies on bone. There's so many studies on bone regeneration. And you really want medium intensity. If you're looking for like osteoporosis, non-union fractures, broken bone, high intensity is not the way to go. In fact, the PhysioSim study, FDA-approved studies, show that when you go higher, the bone regeneration goes down. And there's more, and then the Dinez study, I've got a couple other studies on the bones that show that when you induce too much current, the bone doesn't regenerate as well. So if anything, it heals you slower for most tissue. And again, I'm going by research. I'm not going by anecdotes. The nice thing about research is the good research is double blind. Like the PhysioSim studies were randomized control trial studies. They were the studies were really well done to rule placebo effect. Anecdotes, you got placebo, and you can get somebody, make their muscles twitch and tell them it's the best thing in the world. And that maybe it's just all it is a muscle stimulator, and they can, oh wow, I can feel it. If they really believe it's healing them, they can muster a high placebo and they can create a high level of healing. That's the problem with anecdotes and again, with low intensity, medium, everybody's got testimonials, it seems, right? And hard to believe testimonials anymore. But I mean, I personally have seen PMF change lives, and I collected a lot of video testimonials because I felt the videos were more convincing, because written with AI now, you can almost just get AI to write testimonials for you. So I tell people, and you got to be careful, just a little side note, like with online reviews like Reddit threads and online stuff, you have to know that people are disguising themselves under fake usernames that work for companies coming in saying that this brand is great. You can't believe reviews and testimonials so much anymore. Either some are valid, but then a lot aren't. So, but good research, that should be the bedrock and the foundation of your investigation. That's why my buyer's guide has now over 400 research references, because anecdotes have like the limitations I just mentioned, and then people just exaggerate things on top of that. So that's the problem with it's but all these tissue regenerations seem, and it's not just bone, it's tendon, ligament, nerve, skin, joints, cartilage. All these tissues, medium intensity had, especially some of the Masari studies, they really showed like really great effects on regenerated cartilage, even disc regeneration. Which I've seen with the medium intensity that I'm working with, which is a similar intensity range to yours. Someone grew a couple millimeters in their spine, and we had before and after X-rays to show it, right? So for regeneration, what you want is a medium intensity, and this is my advice now, for home use, to use every day, and try to get a half an hour, because again, the Masari study give a good case for a half an hour to saturate A2A receptors for a half an hour, because when you shut off inflammation, you also turn on healing. It's like a teeter-totter, because inflammation is catabolic, right? So if you're in an inflamed state, it's hard for the body to regenerate. As soon as you shut off inflammation, the teeter-totter gets now into anabolism, or an anabolic building, regenerating effect. So you definitely you do get the fact that the medium intensity had the anti-inflammatory studies goes with the regeneration as well. But give it like 3 months. Like if you have some real damage, it takes your body time to heal. But my experience has been that PMF seems to cut the healing time in half on average. And in many cases, it just heals better than if it didn't. So not only does it cut the time in half and helps you heal faster, but it helps you heal better too. And I don't think high intensity does I mean, again, I'm going by research and my own experience too, but mainly by research that show me, I mean, I'm still waiting. I mean, show me the studies that high intensity regenerates better. And good luck. I've looked, I haven't seen many.
So a couple of things I want to touch on in your answer there was, one of which is that, you know, people can feel high intensity and they can't feel low intensity, and that they tend to be in a lot more clinics. You said the Pulse XL is the kind of device of choice in a lot of professional settings in America. And I think that's important because, you know, a lot of people think that, you know, putting a value to a product as well, you know, if they've got $40,000 to spend, they want to spend it on that most expensive equipment, whether it's going to get them more results or the same results. They kind of just want to spend the money knowing that they're going to be one of these clinics with this high intensity device.
Yes.
It also down to the people who can feel it. You know, they want people to come in. They want them to be, you know, kicked hard by this PMF device that's going to jolt their muscles. And like you said, you know, even if it gives these guys a placebo effect when they leave, whichever way, as long as they leave happy, that's what these clinics want to do. So it's an important point to kind of summarize that you brought into there. And, you know, it's a benefit of high intensity in terms of the feeling that you get from it. But like I say, whether it's getting us to the destination quicker or not is, you know, to be proved by science eventually.
I think the proof is on the side of more of a medium, and so even you can say low intensity has a lot more regenerative studies than high intensity. So again, I can't say I've looked at every PMS study, but see Dr. Pawluk being a high intensity promoter, the fact that I literally went through all of his citations and all of his books, contributing chapters, ebooks. I got them all. It took me 3 weeks and 750 and and I removed the duplicates. So it's actually a lot more than that because he cites a lot of the same studies over and over. So and there were very, very few regenerative studies in all of what he was referencing, where he himself was referencing dozens of regenerative studies for medium intensity. I mean, you're right. Maybe there's still more investigation to be had, but because we saw from that meta-analysis, only 2 to 3% of the studies are high intensity. Pretty sure Dr. Pawluk's high intensity citations were a pretty good sample size of what high intensity studies are out there. Because I'm pretty sure he would be wanting to get as many of those as possible in his articles, right?
Yeah, and I mean, the other thing I wanted to touch on, the second thing in your previous answer was the reviews online. You know, being a brand owner myself, you know, we get approached by people from social media, affiliates, brand ambassadors, and all these sorts of things. And a lot of the time, it's, you know, lace my hand with some money and I'll say whatever you want me to say. So there is a lot of that going on. You know, there's a lot of kind of multi-level sales. There's a lot of affiliate marketing. There's all these sorts of things, you know, and even worse, we're seeing it more so with these, you know, crystal Chinese gemstone mats because they've got, you know, I know I've had a look into it. You know, you can go on Alibaba, you can buy these things for $200, even less, you know, and you just throw your logo at them and they'll put their logo on it and away you go. You know, you've got a PMF mat that does 5 different things very poorly, but they're selling them for $1,800, and you know the margin in those things is incredible. You know, no wonder these guys have got so much marketing budget and so many affiliates on their books and so many people singing their praises because, you know, they're lacing lots of palms with all the margin they're being made. And I know, manufacturing my own device, how much it costs to actually put a good PMF device together. You know, and to try and compete with these crystal gem mats is very difficult, but we're starting to lean against the, you know, they're not competition of ours. We need to sell our mat for what it's worth. So yeah,
I mean, you and I are two of the few people that are really exposing them on the larger scale, like as far as like larger YouTube channels. Because even Dr. Pawluk just yesterday interviewed the owner of Higher Dose and is like, oh, this is a great alternative to lower intensity systems that cost a lot more. Like you buy these MLM systems, they're 6,000 and yours is only 1,000. And so he's encouraging her with the higher. I couldn't believe it. I'm like, are you kidding me? He's like now helping them. He's interviewing like you do a lot of different people, but in good ethics, I couldn't interview someone that
we've been approached by
promoting and making something that was not a good product, right? Maybe I'm being judgmental, but I know in the case of the higher dose, because I've owned it, dissected it, tested it extensively. I don't want to say too much about it because, but it's better to just say these crystal Chinese mats in general, because the easy identifier is, does it have crystals or gemstones? If the answer is yes, now I've got 12 of them. That's pretty much garbage from my testing. And it's like, I don't say that lightly. I say that because there's nothing in those mats that's of really real any therapeutic value.
Yeah.
In fact, it's the opposite. You can measure electric field, dirty electricity. You can see that it's just 60 hertz, or in your case, 50 hertz just getting turned on and off. There's no real signal generator. You just see 50 hertz or 60 hertz.
Yeah.
When I first tested those, I couldn't believe it.
Yeah.
I really thought I was going to see a 7.83 sine wave when I first got the first one that claimed to have a 7.83. But what did I see was 60 hertz turned on and off about 7 or 8 times a second in a 1 second window. I'm like, what in the world is going on here? And I finally figured it out. I was like, oh my gosh, that's just 60 hertz.
Yeah.
They're just flipping 60 hertz, or they're just flipping on your outlet power on and off like a switch. Calling that and putting it through a cheap coil and calling that PMF.
Yeah, and I think the problem is they've got hold of this technology and they've tried to make it as cheap as possible. And unfortunately, as we know, dissecting these mats, it's not a cheap technology. It's not something that can just be thrown together. We did a episode with Steve Burdett on here, and he mystery shopped a couple of these Chinese manufacturers and asked them a bunch of questions, and a lot of it they couldn't answer. They didn't know what the intensity was. They didn't even know what slew rate was. There was, it was just, and they started asking us how to do the intensity testing and all these sorts of things. And you think, you're making these in a mass production line, selling it to thousands of people, and you don't even really know what it does. And again, the brand owners, do I blame them for giving out cheap, nasty knockoff products? Not so much. It's just that they aren't doing the testing. They don't really know what they're selling.
They really don't know. I know some people that know some owners of these companies. I won't name the company name, but they were actually open to maybe even talk. He's like, I might want to talk to you, Bryant, because they really think they're promoting something that's good. I like, they don't even know what they don't know. I think they just saw everybody's promoting these and that it's reviewed very well. And you and I know it's all fake review sites that are in many cases by one company. I can't name the name, but he's got like LLCs and he's got all these review sites set up, but he owns the review sites, and it's just a scam promoting gem. Then you can see they're number one, of course. I mean, of course they're number one because it's a person that's the company that owns the product is creating the review site.
Yeah, that's the thing, exactly. And
that's what you can't believe these review sites, and even the Reddit threads now. People are trying to find unbiased advice, and you got people from especially the armies of affiliates from all these gemstone mats that are creating seemingly what looks like actual end user profiles. Oh yeah, I've used the so-and-so crystal mat, I've gotten great results, but that's just an affiliate going in Reddit threads and putting all these comments everywhere. Oh yeah, this is really good. This is really good.
Yeah, exactly. So
you can't, unfortunately, there's really no place on even these Facebook groups now. People are coming in and it's just promotion. I mean, it's just
it's the way the world is these days.
Why you can never go wrong with defaulting to actual clinical studies, to actual physics. Like, let's look at a slew rate. To me, it's like, this is how you transfer energy wirelessly. I mean, PMF mats are wireless energy transfer. We have to understand a little bit of physics that you have to have a fast changing magnetic field to transfer the energy to your tissues and cells. This is not debatable. Now what's debatable is when this energy goes into your body, what are the mechanisms of how the body transduces that energy? That isn't still fully known.
Yeah.
Although we can see things like the A2A receptor, transduction, and other pathways that get triggered, it's still but we know that the only way to get energy in is either through, well, you can do magnetic resonance, but as I explained, the higher the slew rate, the more frequencies you get on a spectrum analyzer. So by default, if you have a high slew rate, you got a lot of frequencies in the spectrum.
Yeah.
So the device that I've been kind of affiliating with also, it's like 0 to 20,000 hertz on a fast Fourier transform. So beautiful spectrum of frequencies. And yours is probably a nice spectrum as well. If you do an FFT like on your, or like a spectrum analyzer, I bet you have a good spectrum as well. Because if you have a fast changing signal, so you get the only two ways, this is the only two ways that you can transfer energy wirelessly with a magnetic field is slew rate or Faraday induction and resonance, magnetic resonance. And there's not any others. So that's why when you stick with science, it's like, okay, if slew rate's the way to do it, then maybe we should be looking for a higher slew rate because it does have not only research, but physics to support it. I mean, it just makes sense that that's the case. And yeah.
And also, one thing I want to touch on on this episode is the application of a PEMF device, because especially when it comes to the high intensity range, but now also some low intensity range devices, they only just have a localized applicator. And again, it kind of just comes into the PEMF bracket and they give the same benefits. And, you know, you're going to get whole body inflammation reduction and all this sort of thing. It's always been my recommendation that if you want a PEMF device, you start with a full body mat, you know, with whatever, you know, if you want a localized device to put it on an area and to intensify it in that area, great. But start with a full body mat. Is that the same notion that you have? Oh yeah. I've been saying that for 18 years. I mean, and again, this just comes from my holistic understanding, because I was pre-med at Georgia Tech. I mean, I got a physics degree, but I had a double degree in biology. That's why it took me took a year off and did work study. That's why it took me so long to graduate. But I did have another degree. I mean, pretty much another degree in biology, pre-med. But the human body, when you think about it, when you do a full body treatment, you know, let's say you have sprained your ankle even, or you even stub your toe. You need to get oxygen and nutrients and from your digestive system, your heart, your lungs, down there, and from your immunity, the neutrophils and macrophages, they all have to migrate down to the injured area. That's a whole body phenomena. And then you got the nervous system and the endocrine system sending all the signals and messages to like trigger all the healing responses. This is a whole body phenomena. So even stubbing your toe is a whole body healing event. You know, certainly the brain is kind of the center of it all. So, and then when you really think about like how the body's interconnected through the nervous system, the cardiovascular system, you know, the blood vessels, the lymphatic system, the meridian, the premovascular meridian system, the connective tissue matrix. These webworks, or these fractal branching trees, I call them. They connect your body from head to toe. And it's always made sense to me that you want to open up all those networks. And that's a full body mat. You can't do that with a local applicator. I mean, you can do it a little bit, but you know, when you think about it though, if PEMF increases nitric oxide, which helps not just with blood flow, but helps with lymphatic flow, and nitric oxide helps your tracheal, your lungs, the airways to dilate too for airflow. So just take that as one example, if PEMF increases nitric oxide, which studies show it does, then don't you want to improve that flow of lymph, blood, and air throughout the whole body, not just one little area? I mean, now, yes, you could say, well, it's going to stimulate nitric oxide down there, and that's going to migrate to the whole body, but not nearly to the effect if you can do the whole body. It's like red light therapy. I have a red light therapy bed. I'm fortunate enough to have one. And, I work with a company that makes red light therapy beds, one of my other side passions. But I've used little red light little pads and stuff, and there's nothing like a bed. Yeah. I mean, it's just absolutely next level. I mean, and I felt that just energetically, even I had a full body. A bed is just next level. So, and the same with PEMF, I've used a lot of local applicator PEMF devices, and it's like, it doesn't seem to do as much. I mean, now I do think it's like a 1-2 punch, right? It's like you do the full body mat, like a half an hour. And this is Dr. Pawluk, I agree with. He actually, again, he references his Masari study. So he also recommends a half an hour. So I think that's a good
It's just he's recommending high intensity instead of medium. But half an hour full body, and then use the local applicator. And there's really no time limit. I mean, again, look at the study with inflammation and regenerating cartilage. They were doing 5 hours a day for 90 days. Now, the slew rate on that device is about 3.5 Tesla a second. I figured out it wasn't like a superlative or great slew rate, but it was, decent, I guess. You could say that's modest. So my guess is if it was a better slew rate, but you wouldn't maybe have to do 5 hours a day. So I'm not saying to do 5 hours a day with local applicators, but really, if I hurt myself, I mean, and I'm just relaxing or reading a book or watching a movie or something, I might do several hours a day with the local applicators. I don't skip my full body mat session to open everything up.
Yeah.
Right. So I think that's the best 1-2 punch, because the benefit of doing local application for long periods of time is that I've found with the full body mats, you can trigger too much of a healing crisis, because when you open up everything for too long of a period of time, it can just be too much, right? Where the local applicators, you're just focusing on a spot, and then you can do that for several hours, typically no problem, no Herxheimer, no detox reaction. Not that healing crisis is a bad thing. I mean, I'm just saying it's just a lot to have your whole body, like to do several hours a day on a full body mat. We're doing several hours a day with a local applicator is no problem.
Yeah.
But a half hour is a really good, to me, a good goal to try to do a half hour full body every day. Even versus 15 minutes twice a day, I would say just do a half hour once a day.
And I've seen these like large coil devices coming out onto the market now, like a big coil that you hold against your body, and it's not necessarily a high intensity device. So it's kind of like low intensity, big coil. They kind of claim less is more, use less turns, but more current. What's your thoughts on these kind of big coil products without the mat?
I had a Magnosphere I rented it for like a couple months. It was 6-inch diameter coils, huge. I mean, I set a chair between two huge coils, and it was using picotesla intensities, which is a trillionth of a Tesla, very, very low. Now, they had some good anecdotal testimonials, but I felt it was very, very subtle, right? I think, again, to me, the lower intensity, I do think can heal. It just heals a little bit slower maybe than medium. The lower intensity, even for healing, I would take over high intensity based on studies I've seen. Because again, lower intensity still has more studies than high intensity for healing. But larger coils, it does become more difficult to get a higher slew rate the larger the coil. Now there are some ways to kind of you could say little hacks that you can do, sever coil type of design in large coils to lower the inductance and to lower the resistance so you can get a higher slew rate. But typically with larger coils, most of the time you're gonna run into a lot of inductance. Then you get hot spots where the coil is, and then a cold spot in the middle. That's the other problem with large coils. Unless you do it right, you have to. There really is a way to create larger coils to give a pretty uniform feel, but it's a kind of a tricky engineering hack that you got to get into. But typically, I don't know which ones you're referring to, but because you're not talking about like the amp coil or some of the element or the.
Yes, more similar to amp coil and Halio products.
Those are about they're not like huge coils, but there's many windings, and they're definitely not. They claim to be full body treatment, and yes, you can make the case that magnetic fields. Yes, they're like these. Electromagnetic fields do have an infinite range, but you got to understand that. It's not the inverse square law, but with the Biot-Savart law, the intensities do drop off. But the main flux that you're getting is through the center of the coil, perpendicular into the body.
Yeah.
And then the field, it's like the energy flows are like a torus around the coil. It's like a toroidal flow, right? Like the same as a bar magnet,
Yeah.
But I still think you really want to get a full body mat. But then you do want good local applicators to really drill in on those injured areas, so you can work, because that will help you to heal that injured area faster. It's to do the longer sessions. Sometimes people just don't do they say, oh, it's PMF's not working for me. It's like how long you've been using it? 2 weeks. It's like, well, you have an injury. You need to get on more of at least a 90-day mindset and putting in the time. If you're just sitting there watching TV, just put your PMF local applicator on your knee or whatever it is. It's not hard. You're just, the loop, you just put the loop or your little thing, you just Velcro it around your knee. I mean, it's not.
Yeah.
You might as well. I mean, if I'm in pain, if I've injured myself, sometimes I've done up to 4 to 5 hours in a day with PMF. So, I mean,
yeah.
When I had a car accident, my hand was all blown up like this. I probably was doing 5 or 6 or 7 hours a day with PMF.
Yeah. And I think that's important. We're saying like localized devices you can use for longer periods of time, especially if it's battery operated, you strap it on and leave it there and, it's working its magic. With the full body mat, you don't necessarily need to use it for quite such a long period. No. And obviously we don't want to encourage people to be sitting there 4 hours and all that sort of thing. You want to be getting up and moving.
Oh, you're right. Of course. Yeah. I mean, it goes without saying. I'm just saying if you're just sitting there watching a movie anyway, I mean, you can, or reading a book. I mean, again, if I have an injury, I can even be on the computer doing stuff. And if it's my knee or whatever the injured area is, I can just put that on there. And I mean, again, Robert Dennis, makes a good case for that as well. Is that using a medium or lower intensity for longer periods of time, he's found helps to regenerate better. And, then this high intensity for short period of time approach doesn't.
Yeah.
Like you said, in a clinic, high intensity, I think that is what you said is a good point for a good application, high intensity in a clinic, because people want to feel something. And if you them excited about PMF, even if they don't really know what's going on. But then at the end of the day, you need to educate them that they should be going home with a medium intensity device, ideally, to use every day. So that, to me, that's the goal of a clinic, is if people come in and use PMF and get excited about it, maybe you help their pain, give them some analgesia with high intensity, because it will do that. But then educate them that they need to invest in their own mat to use every day.
Yeah. And something we haven't really talked about before on the podcast, and something I wanted to talk to you about, because we mentioned it in your notes and in your research. And something we found when we were developing Celerate was that, we had the ability to change the polarity from north to south. And we were trying to figure out which one was better, whether north was better, south was better, or if there was certain kind of if there was a right way around it. But what we actually found is that there was a bipolar or a unipolar approach, which is effectively switching it from north to south quite frequently, was actually getting a better result to the cells and to the cells, to energizing the cells a bit quicker. Again, is that something you found with the research you've been doing?
Yeah, I mean, it comes from Robert Dennis's research with like the NASA study. And I mean, because I like how he explains it, because if you have, it has to do with kind of if the signal, if the square, it's always going the same direction. If it's unipolar, it's going to be an oscilloscope, it's going to always be above the x-axis, or right, but it's sort of like the way Robert Dennis explains is that you don't want to overcharge any one particular area. So it's sort of like when you go, let's say 10 square waves this way, then 10 square waves then it'll be upside down to make it a bipolar where it's all balanced. It kind of is a net zero. You're not overstimulating any one area. Sort of like, and even like the pacemakers, the currents, they make them more bipolar because they find that they wear out more. If it's always going in the same direction, it can cause little burns on the tissue, number one, and it'll just wear out the system. So by backtracking, it's like you're flowing the ions in one direction, creating energy, then you're turning around going the other way, so that way you're not overstimulating any one area. It's kind of like you're creating a net zero. It's like everything gets balanced out. So it's just I guess the word is balance here. It's a more balanced way of doing a good square wave. So, and I talk about this in my buyer's guide, mainly from some of Robert Dennis's like research and motivations. And it makes sense to me. I mean, because again, you have engineering, sort of like proof in engineering with pacemakers, why the bipolar is a better, more balanced way to do it. So So yeah, I do think, and again, you can either go 1 up and 1 down, or you could do 5 up and then 5 down. That still balances. So it's sort of like, in calculus, you're integrating. When you integrate the whole thing, it should come out to 0 because the amount of negative is equal to the amount of positive.
So just just kind of wrap up this episode a little bit, because we're really here to talk about intensity and that sort of thing. So
yeah,
where would you say are situations where you would, because we've debunked a lot of the myths in the high intensity range, where would you say high intensity is best suited? So, is there a situation that someone has spoken to you and you think, actually, you know what, not low, not medium, but high intensity is best for you? When would you say that?
For a person for home use, really never for me. Now, if it's a clinic, it's different, because this is what I've come to find, is that when you have a lower medium intensity in a clinic, people are impatient. They come into a clinic, they want to feel something. It's almost like they go away unsatisfied if they don't feel something. Now, unfortunately, like with, some things you definitely feel, like if you get a massage, you feel that, right? If you go in a sauna, you certainly feel a sauna, right? Red light's a little more subtle, but you certainly feel some of the warmth from it. But PEMF is just more subtle. And to put it in perspective, some of the healing transduction pathways and signaling pathways take up to 4 hours after a session to start triggering. So a lot of the healing isn't even happening when you're on the mat necessarily. I mean, some is, but it's got like a domino effect that ripples into the future. So, but because people want instant gratification, it's just the nature of, here in America, for sure, I can speak for America. Everybody wants fast results. They want to feel something now. And high intensity gives people a taste of, yes, this is doing something, and it is very good at analgesia. And again, over 100 million Americans are in chronic pain. So high intensity in a clinic, or a pain clinic especially, would be a good place for high intensity, because it does help to numb the pain. But then again, if I'm going to be a responsible educator for these clinics, I'm going to be like, you should have a couple shelves stacked of medium intensity devices, and be trying to get people, send them home with a medium intensity so they can, as quickly as possible, start to do the real healing. And again, of course, as we talked about, high intensity has a place in psychiatry and rTMS, but that's a very, most clinics aren't going to have an rTMS system. Again, most clinics here in America have, like, say, the Pulse XL. Now, I will say the high intensity is very invigorating. So I guess that's another, if you're just a multimillionaire and you can buy everything, but I don't know if I would use it every day, but it is, you do get kind of a little bit of an energy rush. It is very energizing.
Yeah.
I'm not going to say it's like I give the 5-hour energy example sometimes versus multivitamin. It is kind of like that. Because it's very stimulating, but, so let's see, where's another application? Well, again, certainly pelvic floor and
muscle stimulation,
and that's like,
that side of things.
Like the QRS has like this pelvic floor stimulator, and some of those urinary incontinence studies. So any type of clinic that is dealing with that, I think that's a great application for high intensity. Drug electroporation, again, drug delivery.
And I think that matches exactly my application for high intensity, because being someone who's developed a medium intensity device and now kind of in the middle of developing a higher intensity device, my basic use is using medium intensity or low intensity every day. That's kind of my basic go-to product. And then I'll maybe reach for a high intensity once a week, to kind of give me that boost, give me just something that, the combination of the two therapies. But like you say, I wouldn't really ever turn to a high intensity device daily. I just think it's too much energy.
It's too much to do every day. And I use that every day for 3 months. But I do, of all the high intensities I've tried, this is my favorite. All the ones I've tried, the Pulse XL is my favorite. But I just know too much about it. I take my, I can take these RF meters or my tri-field meter, or my Coronet, I don't just do one test. I'll do multiple tests just to make sure it's, and all the high intensity units are there's a lot of high frequencies in all of them that I've tested. So again, they're short bursts, yes. But, you know, and that's why if you do it once a week, it's not like you're not getting that much dirty electricity because it's just for a short period of time, you know. But if you do this every day, as, you know, what's his name? A well-known electrosmog researcher. He talks about the cumulative effects of electrosmog. It's just like, it's almost, which is a little counterintuitive. You wouldn't think that's the case, but it is like mercury. I mean, if you eat the wrong kind of fish over a long period of time, you can get mercury toxicity because it builds up slowly, right? Well, electrosmog also is cumulative. And there's a good study to show this cumulative effect of electrosmog. So again, this is another reason why I wouldn't do it every day. But in general, I don't think that it's dangerous. I mean, I've kind of, maybe in the past, I might have been a little stronger in those words. And I think some of the MRI studies show that you need to get to a cardiac stimulation. You're going to feel nerve pain well before that. So I guess the good news is, and I tell people, when you use high intensity, if you're feeling nerve pain or any discomfort, turn it down. And this is not a no pain, no gain thing, because the cardiac stimulation or the nerve pain and the discomfort precedes cardiac stimulation. So you don't, especially if you have heart issues, you definitely want to listen to your body. So if you feel discomfort, which is usually from the neuralgia, the nerve pain, more than it is the fasciculation, the muscle twitching, it's more, what you're feeling is more the nerve. And I did this with the Pulse XL. I was trying to follow their protocol, gradually turning it up. And I did see I could tolerate more and more as time went on, but you know, you don't want to feel that discomfort. And I think some clinicians try to push it a little too hard. They try to turn up the intensity on people more than they should be.
Almost becomes a competition sometimes, doesn't it? Especially with the user.
You have to get, because there's very little research, and even Robert Dennis, who kind of agrees with what I say about high intensity, because I've read his whole forum, he says that, yes, maybe because he said if somebody paid me several $1 million, yeah, maybe I could spend several years to study high intensity in more detail. But the research is just lacking right now. So going by the anecdotes, you know, I would say the most important tip for clinicians is just don't push people. Just you have to get feedback with high intensity, which is not the same with medium intensity, because rarely, I mean, yes, you do get a Herxheimer reaction with some people with a medium or a low intensity, but usually it's not as much of an issue. With high intensity, you can feel the discomfort right away.
Yeah.
And you just want to back off and not push that. But I think it's still safe, you know, it's rare that there's going to be any problems probably with most, unless you have a heart issue. That's the one case I don't think I would recommend high intensity because again, the heart's the most electrical organ in the body. And, you know, even Dr. McCullough's wife had an episode using high intensity with like an AFib episode.
Yeah. So something you should be cautious of.
It can happen. So you want to, but usually it doesn't. I mean, I've talked to a lot of clinic owners, and it does seem most people are okay as long as you don't, you know, go too high.
No, just before I wrap this episode up, I just want to give maybe a bit of credit and also a bit of a call out. You know, we have spoken about Dr. Pawluk in this episode. You know, we've talked about his inverse square law and how, you know, we're not necessarily agreeing completely with it. You know, my beginnings and my startings with PEMF therapy, I used a PEMF device, and then, you know, because anybody that looks into PEMF, they're more than likely to come across Dr. Pawluk. He is a leading name in the field of PEMF therapy. He's got his books, like you say, bestsellers in the PEMF industry. And he did come over from the USA to the UK to actually meet me in person and give me some training originally, which I did kind of, you know, did think that was quite an honourable thing for him to do. And over the years, you know, that was about 14 years ago now. But wow. So we've had a relationship over time, and we even had his table on our NewMed website at some point, you know, and because a lot of my training came from his books and all this sort of thing. But, you know, it wasn't really until I started questioning a lot of the intensity and all this sort of thing that I kind of started seeing the cracks appearing in our relationship. But mainly when we released our own product, you know, I was quite excited to tell Dr. Pawluk, you know, we've got our own product now, and maybe you want to be a representative for it in the US. And it was almost like overnight, the conversation ended with us. And a bit of a strange, because we were buying products through him, selling it in the UK. And, there's no financial incentive there now for us to continue this relationship. But, whatever his motivations are, and one thing in terms of the call out, what I'd like to do is say, if Dr. Pawluk, if you are listening to this episode, or if any of your team are, we'd love to have you on to show your side of this story. As I say, we are very diverse on this podcast. We do offer, we do get all the industry leaders on, and it would be great to get him on. So, we have actually invited him on twice and haven't had a response. So maybe this will be the point in which he'll reply.
Because I did also have a relationship with him back in the day. Because when I don't know if it was around 2013 or I don't know what year it was, but he was much more pro low intensity. I mean, he's always sold a range of products, right? But he was very much pro QRS. He was pro IMRS. He visited, the Swiss Bion, or at the time MediConsult, like manufacturing the Rob Group. And there's even a video clip of him singing praises for how well it was made and stuff like that. So, and of course, he was the person that did all the consultations for QRS. In fact, when I bought a QRS in 2003, guess who I got a free consultation from? So I first talked to Dr. Pawluk in 2003, just a half-hour consultation. But then I did meet him in person, because he came to one of MediConsult at the time, or Swiss Bionics, like conferences, and he was a keynote speaker. So I got to sit down with him, talk to him, and he would refer some, because it's funny, he was like because at the time it was ML, it was like a matrix system, and he was like in my downline, right? So he would refer, not very many, but maybe 1 or 2 IMRS sales a month back to me. But then there was then all of a sudden, on like QRS and his videos on these lower intensity, he says he just changed the description of the videos. I no longer recommend this unit. Like, it was just like that. So that's when the relationship just kind of soured. And it's like, I don't know what motivated him to go to this whole high intensity road. But before that, he was very pro. In fact, I like some of his older videos. I like some of his old stuff. I learned a lot from him. So I still think, because again, most of the studies he references are medium and low intensity. That's why I think this is a good book. So in this book, there's only 5 pages of bad science, right? Most of the book is pretty good, except again for the recommendation section, where his second book, though, half of it, and again, the first half is pretty good. It's like a history of PMF, EMF versus PMF. But then the whole second half is all recommendations, and every single recommendation is based on the inverse square law and this Masari study, like I explained earlier. So that's why I think it's important. And this right now is the #1 selling book on PMF. Mine is like number 2, but his is the top seller most of the time. But because people are buying this book, they need to understand that half of the recommendations aren't based on reality. I mean, it's not the inverse square law, and the very study he's referencing didn't follow any type of drop off anyway. But if you really read the second half of his book, there's over 30 recommendations that are just wrong. Right. So I would love if he could come on your show, and I'd like to hear his answer to this, because I mean, I'm sure he's going to have a response, it would be nice to get a conversation going.
For sure.
But he's not. Someone tried, there was a podcast that was trying to get both me and Dr. Pawluk on the same show, and I agreed. And Dr. Pawluk didn't agree.
And I think maybe that's why he doesn't want to come on this one, because we've got some conflicting arguments. But like I say, we're open to both sides of the story. We want to know, and we're not saying that high intensity is bad. We're just saying that it's not the only option for everybody, which I think is...
For me, it's not that high intensity is bad. It's that using the inverse square law plus this study as a justification to recommend high intensity for all these different conditions, that's just wrong. It's not even... I don't even know how you can debate that, because I know his tables are based on a 1/4-inch radius or 1/4-inch diameter sphere. Which again, is in itself absurd, right? And I get it, he's a doctor, he's not a physicist. And you know what he's going from on the inverse square law. In a medical textbook, they have a section on radiation biology, And it turns out that for radiation, like radiation for cancer, for example, treatments, that they show the inverse square law from the radiation device as an inverse square drop off. But in those cases, you can approximate it as a point source because again, it's the radiation is coming from up here all the way down, and it's just a small. So it actually, the inverse square law works for that type of application. But PMF coils, you're laying directly on them, and they're large coils. They're certainly not point sources.
Yeah.
Right. So again, that's the issue, is that it's not that we, like you're saying, that there's no place for high intensity. It's just that, recommending high intensity based on the reasons Dr. Pawluk does is just wrong. And it's easy. So I think hopefully maybe he'll see the light one day and then say, oh, I'm going to take my book off the market. I'm going to republish it with the correct equation. Maybe I still recommend high intensity, which is fine, but have a good reason to recommend it.
To do it, yeah.
So anyway, yeah, that's my 2 cents.
Anyway, we could. I said this on the last one. There's so many more subjects we can talk about, so we might have to get you back for a part 3. But
I'm sure you come on anytime. Honestly, I mean, I just want to come on. Like in this case, I wanted to come on because I just spent like 3 weeks going through all these studies, and I just had all the things that I wanted to share. I mean, which is, to me, I haven't heard in the PMF industry being all these things getting talked about.
Yeah.
And to me, they're really exciting, big insights into, not just intensity, but just kind of like what are the best PMF type of intensities, slew rates, whatever to use for different types of conditions. So.
Yeah. And if anyone wants to take a deep dive like we did before this episode, where can they find that webpage with your buyer's guide? And also, if they want to talk to you, how can they do that?
Yeah, so just go to bryantmeyers.com, just my name, BRYANTMEYERS.com. I'm transitioning it's not a fancy website right now. It's just kind of where and you'll see my phone number. You can call me for a free consultation, 941-928-0124. I mean, no obligation to buy anything. I offer free consultations because I'm passionate about getting people in the right direction. And, and even if people don't buy from me, if I find they're getting a good device, I'm okay. But what makes me sad is when people, buy these crystal mats, for example, or it's like, because I know they're not getting a good first exposure to PMF. So that's why I do these free consultations, so that people can be steered in the right direction. I always give people, I say, before you press buy now, just call and hear me out.
Yeah.
On any PMF device, because you're probably going to want to hear what I have to say. And so it's my passion. So I do offer the free consultations, and my buyer's guide right now is, you can just read it online. If you do like you did and download it, it is about 200 pages, but I did create an abridged version. So you'll see on the bryantmeyers.com, there isn't a shortened, if you don't want to read that full version, if that's too much for you, just read the abridged version.
Yeah.
And so I did that specifically because it was too much for too many. For most people, that was just too much, but I'd rather be over the top and be as accurate as possible than to generalize too much and not to get into the details. But
100%. Okay, for our listeners, thanks so much for listening to today's episode. Again, if you enjoyed it, please subscribe and leave us a 5-star review on your favorite streaming platforms. It's really going to help us bring more great guests like Bryant Meyers to share their knowledge with you. So thanks again, Brian, for your time.
Oh, it's been my pleasure. It's been fun. Yeah. All right, Andy.
Cheers.
All right, take care. Cheers.